This is CBC Saturday News.
Hello, I'm Marivelle Tarouk. Despite major inroads in the battle against new HIV cases in this province, doctors say there's still a lot of work to do. One of them is making it his personal mission to make antiretroviral medication more accessible and affordable. Devin Haru spoke to Dr. Michael Fanous about PrEP, a drug that until now has been too expensive for many.
What is it, who's using it, and how difficult is it to access?
Absolutely. So PrEP stands for pre-exposure prophylaxis. It's the use of a daily medication to prevent a lifelong infection with HIV. 99% effective. It's more effective than condoms, but it can be used with condoms. It can be used also with treatment as prevention. That's preventing the spread of the virus by treating those who are HIV positive. Unfortunately, the gay community has been affected disproportionately by this virus for years. 1 in 4 gay men in Toronto have HIV, and we can lower that number with the use of PrEP. We're seeing these numbers not only in studies, but in the use of PrEP commonly in other cities around the world. We can half the number of new infections. There are over 1,000 people in Ontario infected with HIV every year, 60% of whom are mostly gay men.
And so we have PrEP, but we seemingly see the relation to cost and accessibility. Tell me about that.
The number one barrier to my patient base, which is mostly gay men in Toronto, is the cost of PrEP. Now with a generic, we can lower that cost even further. However, listing PrEP on the ODB formulary, the Ontario Drug Benefit Formulary, would be of greater assistance. We need to approve these drugs first, if they're safe and effective, and then we also need to cover it for those that are at highest risk, and gay men are at highest risk.
Big picture, I see you talking to a lot of people in this community. I know this work is personal for you. Tell me about what you hear on the front lines, what this would mean. I hear the word game changer in relation to a more cost-effective generic drug.
Absolutely. The use of PrEP is equivalent to the use of birth control among women. If we can prevent pregnancy with a pill a day, imagine preventing a lifelong infection with HIV with the use of a pill a day. If only governments and healthcare workers were aware of the great disparaging costs and challenges to getting on PrEP, then we could really help end the AIDS epidemic today with the use of PrEP.
And just for some perspective about the cost, Marivelle, right now for an individual it costs $1,000 per month. And what Dr. Fanous and so many others in the industry want to get that price to is about a quarter of that cost. $250, Marivelle. No question that would make this drug so much more accessible for so many other people.
And something I think a lot of people are wondering, Devin, is how soon could this generic, less expensive version of PrEP be available?
No question, Marivelle, and for many, not soon enough. But what we're hearing from Dr. Fanous and a lot of other doctors is that if everything goes according to plan, they want to have this generic PrEP, this more affordable PrEP, ready for purchase in about a month, in July. But this is somewhat of a bureaucratic mess right now. Health Canada talking to jurisdictions, talking to other health officials in other provinces across the country. So right now, the plan is to have it available, Marivelle, for July next month.
So give us a sense of how people in the community are reacting to this, Devin.
Well, you know, I'm in the village, and it is a conversation, a very visceral, a very profound conversation happening on these streets, Marivelle. In fact, when I was talking over here, just steps away from where I am, to Dr. Fanous earlier today, people, patients of his, were coming up to him, asking him about this generic PrEP. When's it going to be available? How much is it going to cost? It's a conversation that's happening. I also was able to have a conversation with a couple of gentlemen very close to it. Ron Roseness, a man who has spent most of his life living with HIV, knows the challenges and difficulties facing people who live with HIV. You'll hear from him. You're also going to hear from Ryan Lisk. He works with the AIDS Committee of Toronto. Take a listen from their perspective about what this would all mean.
Access to PrEP for prevention has been very important to me, and we need it to be available in this province and across the country to the people who are most at risk, and we need it to be prescribed by a wide variety of healthcare providers.
The challenge that gay men are having is it becomes accessible only for people who have money and great benefit plans to be able to afford access to PrEP. And so this is a huge game changer for these gay bi queer men.
Here we are, Marivel, about 30 years, more than 30 years after the AIDS epidemic claimed thousands of lives, having a conversation about HIV in the city of Toronto, stopping that infection rate. And there is a level of hope tonight as we talk about a generic, more affordable PrEP medication. Obviously, this is a conversation that will continue to track, Marivel.
And a game changer bringing hope. Thanks so much for this, Devin.